everyone, my name is JuanKerica's and I'm a senior at Port Gibson High, and I'm going to do an interview for my Come To class because I want to be a dentist, and I'm going to interview a real dentist to see how it goes. Okay, you want
Oh. I'm Dr. Latoya Kohlenberg Akins. I graduated from the University of Mississippi School of Dentistry in 2011. I am from Fayette, Mississippi, but I'm a resident of Flowood, Mississippi. And I'm excited to see what questions she has for me.
Okay, first and foremost, could you describe yourself as a dentist?
As a dentist, how?
Okay, like with operation and procedures.
Oh, what procedures I did. Okay. And so basically here, I work at a public health center. And so things are kind of limited here. And so what I mostly do on a daily basis is extractions, fillings, prosthetics like dentures and partial dentures and things like that. But we are open to doing more. We do a few crowns. We're open to doing bridges. Hopefully we can get started with root canals eventually. We're limited, but we're going to try to expand more because we're the only dental practice here in town.
Okay. And what do you enjoy the most about being a dentist?
The thing I enjoy most about being a dentist is the people. I enjoy the hand skills part, but I enjoy making people smile, getting people out of pain, making people laugh, just being surrounded by people.
Well, that's great. And where did you go to dental school, and how was it?
I went to the University of Mississippi in Jackson, Mississippi. They're a great academic institution. I did have some other issues there, health issues and some other issues, but as far as the academics, they are an excellent school. And so I had a great academic experience.
Okay. And as a dentist, what is most important to you?
The most important thing to me is to firstly do no harm, and to after that to do good. To just get people out of pain, make people happy, make people smile, make people laugh, and just most importantly, do no harm. And the next step is to do good. Most of the time, well, some of the time, to do good is not to necessarily make the patient happy right off, but you want to do the best thing for the patient, and then we can consider, making them happy.
Okay, and approximately how many patients do you see a day?
On average, we see about 14 or 15 patients a day. Sometimes we see more. Yesterday, we saw 22, 23 patients. The day before that, we saw probably maybe 12. And so it can range, but the average is about 14 or 15.
Okay, and what steps are taken for sterilizing dental equipment?
Sterilization. And so the lady with the camera does all the sterilization, so she can tell you a whole lot about that. But mainly we use what you call an autoclave, and it sterilizes instruments under heat and pressure. And so we disinfect them, we clean them off, we put them in something called an ultrasonic, and it shakes the debris off, and then we put it in the autoclave, and the autoclave sterilizes them under pressure that not even a spore, which is something that's not even a real bacteria yet, it kills those as well.
Okay, that's great. And how do you think oral health relates to overall health?
Overall, oral health is just connected to the body in every way. I always tell my patients the mouth is connected to the body, and we cannot change that. Patients who have gum disease, periodontal disease, and have diabetes, the gum disease exacerbates their diabetes, and a lot of times if we treat that and get that under control, it helps with the diabetes. Or patients who have toothaches and cavities and they have hypertension, well, that can exacerbate that, because if you're hurting, your blood pressure is going to be up. And so it's connected in each and every way.
Okay, and how do you handle uncomfortable patients, like patients who are uneasy or nervous about procedures that are going to take place?
Anxiety and dentistry, that's a new one. And so for anxious patients, a lot of times my assistant has a lot to do with that. We have a good camaraderie, a good relationship, and so we don't have to do a lot of talking about the dentistry during the procedure. And so we can sometimes, although we're focusing on the dentistry, we can also engage our patients. We play music. We can talk to them, or they can listen to funny stories that we're telling, and so that they can get their mind off the drill or the water or whatever's going on, to kind of just help them to relax.
Okay, and do you think you'll still be interested in dentistry in 10 years? Why or why not?
I would definitely be interested in dentistry in 10 years. I think that my love affair with dentistry will always exist. Now, maybe in the next 20 years, I will not be sitting chair side, but hopefully I'll still be involved in dentistry in some type of way.
Okay, and are you happy with your performance as a dentist overall?
Overall, I'm happy with my performance as a dentist, but I will never be satisfied. this is the practice of dentistry, just as it's the practice of medicine. And so you are never accepting of your skill level. You're always going to push yourself forward because technology is going to change, patients are going to change, and so you cannot be complacent in what you do. And so overall, I'm happy with what I do and how I do it, but I'm always going to push myself to achieve more, so I'm never going to be completely satisfied. Tomorrow I'm going to take a narcotics course, and that's going to help me to better learn how to better treat my patient's pain. And so that's just another step in never accepting, just being complacent in what I do.
Yes, ma'am. Well, looks like all out of questions over here, so I thank you for your time today.
You're very welcome.
And this concludes my interview, and I hope you enjoyed it.